Yɛde Nyankopɔn ase ɛne society pɛ na ɛde akyɛ yɛn yɛkasa ne din butuo na asedanka ɛhyɛ ne nyam bebree ɛma ne din so na yɛkasa Awurade nhyɛ so wagye adwa na wɔhwɛ THM TV anwummere abononum ne simana ne kakra na ɛbrɛ sei mu no yɛde mapɔmuden dwumadie ɛna ɛbrɛw ɛwɔ yɛ THM TV so na yɛfasa akwanya yɛnyan so ɛkyia yɛn apostle Moses Deacon Amotepe, leader of the Church Through to Heaven ministry on any hokanis of Mami Dina and Yebusianfu in Ayakase Radin Shawn no yon kesi pa sana echia yen prophet Richard Entry on this of Mami Gloria and ne Ebusianfu in Ayakase Radin Shawn yechia yen evangelist Francado evangelist formations or Accra district pastor Papa Radin Shaw pa on this of Mami Doris ne Ebusianfu in Ayakase Radin Shawn no yon kesi pa sana so ni Israel general secretary Osofo Kwame Ade Johnson and Papa Radin Shaw pa oneness of Mame Koko Ade sof Mame Radin Shaw pa ne minyanum ni nyina yɛka Radin Shaw no nyon kɛse Israel asofo ni nyina district pastors ne ahokafo ene afei so yen pastors ne on ahokafo yen elders deacons and deaconess Radin Shaw bibia sanso ne fa akwanya yi so Israel asafo mu asafo mani nyina yɛka Radin Shaw bibia pa homfama ne etu ho acha nyamena mo so di won asafo mu no mfedodo yɛka Radin Shaw bibia no nye obibia kɛse na yɛfasa akwanya yi so Esra anti Benedict Amoni pa say the mapomode producer ba akono no Radin Shaw pa anti Bene ene mapomode crew ni nyina yɛka Radin Shaw bibia ame enamo so di dwumadia ɛso pa ene nyame ayadom se de medical aka no mapomuden so ana na yedi ahyiamu na mapomuden mu no yɛhwɛ nyarewa hodo bi a aba so ana se wo ho ane ekwan ebesi afa nyarewa na no kwan enema ɛha yɛn ɛfa yɛn apomuden ho ene se de ɛbɛya ebesi ahwɛ yapomuden ni so ye na etimi aboa yɛn ama etimi anya apomuden a esipi eno enti na mapomuden dumedi ɛwɔ ho no yɛhwɛ yɛpɛ apomuden mu animdifo eho efutuo a ebeboa yen etimi ama ya bob brapa a ebema yenya apomuden pa ama yetimi ede awie nyam de nyame ahyehya ama yen se agidifoi eno ntino na dwumadi de ehwe se ebeye no na eye yenije na eye ahonhwa se ene nyame ayadom wama yen doctors ene mega wama yen doctor ba ko ye show you so na wasan ama yen eye pediatric nurse e we show you so na ye sha ye wo month of November emu na yɛhwɛ month of November na ehune sɛ ɛyɛ prematurity awareness month yɛka prematurity awareness month we be say ɛno ne deɛn yɛkasa afa ɛyɛ premi anaasɛ yɛka preterm babies ona bibinti na wɔtwe dodo a ɛsɛ undi ansa na nkɔba ta asefo asase so no endi na afei aba mputupru no ɛno na yɛhwɛ ne ɛkwan asa emofra no ebefa so etimi atena se eni mpo dia yebeye edi aboa enkrofo bi sa eno nti ye hwe se bosumi nyina ye tresi ho a ye de bo eye prematurity awareness month anaza ye de ebo premi eho ederopa na aboa aye enkranhye edi ama afoforo na aboa nso ama abofo eni aba ho so anaza apemfo anyinsemfo eni aba ho so na empo se bibi sa happen na kwana ombefa so ama apomuden mu animdifo ebeboa ama bibia etimi atoto wano no ono ahwe ayenisa nti ene no eyema hoho ase yenya MO medical officer in with pedics and as in pedics Dr. Rhoda Edusei ewa hanom san so ne ewo pediatric nurse Madam Donna Weber mpashe mawakwaba.
Thank you.
Radin Shaw yenya mo ye show you to say na yenya Japan na Dr. Rhoda so me ma Dr. Rhoda so akwaba doc mpashe mawakwaba. Radin Shaw say yeto yensafro na maba ye show you so na eneno say ye Deacon introduce and guesty na ye patch wa say wo free TV set na ho ampacho obetimi follow you live e Facebook so na obetimi follow you live e YouTube na eno no obese THM TV na de ho you live e honom na ana say obetimi so follow you live e TikTok TikTok no over search THM TV Studios obe hu yen e wo honom na wa follow now the comment e dey aba ebia na wa for premium e bi pen ebia wo question bi efa preterm babies ni ho ana say wo hu enioma bi efa abofra bi o sa preterm na oye preterm baby o assembly se bi wo ma obetimi dey afa ho e dey aba na wa ajinhwe bi wo assembly a obepese o kan obetimi dey aba na megidi se ebebo show no na sanso na ebebie phone lines atum ye bema kwan ama won so abo rem na o questions no o dey afa honom e dey aba nti ansa na yen so redwumadie ne so no na yen nyina yen nya chefa nti yesel say ene yen mmom indi dwumadie na obetimi so e dey text message e dey afa 0541479344 0541479344 mpacho no self fra yentimi emfa no emprempren nti yesrewa obetimi dey text message ana say o WhatsApp message e dey afa honom na dey fa honom e ba ye be kan ama radin sha so be yen sa na yenche ho na ma Deacon introduce your topic here na ye be pese ye ti ase ana say ihu nhwehwemu kakra ya ye na de mi sua efa preterm ho mi hu ye say ye si yi emofra ensun bia ba ko ye wono primi ana say ne bre ensun ansa na ya wono nti me pese mention sin free madam Adomako na on my intro and on my entire say you can say premature birth and I say obi aya woni premier me pacho na ye kasa faden ho na say as a chain say na yampa say ye France and I say if you had to take 7 children one of them might be a preterm baby and me pacho boy and work on this
yo me pacho me da say e wa kwenya Truth TV Truth to Heaven TV mo dia mayen say yen so yen brand yen bebo de ru emfa prematurity ho especially bosome November ye bo de ru ache amanse nyina say ye omofra ni bi wo ho a omomre nso ye na omoso abawiase omoso ye nipa enye yare na emoma ye bibinti na amana basa na edikan mepese mede enchia kese ebe kwama Pediatric Society of Ghana PSG enkrabate wa say PSG Kumasi yen penny Dr. Mate omo konfanochi any University Health Services Ken UST yen director Dr. Eisibuatin yen matron Lady Diana any ejuma mpenyifo nyina yen pediatrician Dr. Betty Dr. Hammond Prof NML Dr. Bavna any yen penny Sister Charlotte and children's ward pediatric unit for nyina ye de enchia kese efa Truth to Heaven TV so mamu nyina ene awie ene ye tiefuo nyina TikTok Facebook and YouTube yo enti ye nkomo ana se ye deruba ye bo nyina ye se ye bo afa prematurity ho enti ye ka se prematurity ko ye den prematurity ne se oba afefuro na yenim se ne yanka efiefo ye ka se 9 months na so no ba pomudin mu aye de ye ka se 40 weeks intini nka wo hwemu panke 10 months okay na enumu na ye ka se abofre biara oba tan be fefuro na adrusi ye be wo no na nyinsen ne betimi akwa se ekodru 37 weeks 37 completed weeks ne sa abofra no ye wo na ye friend say oye preterm ana say ye ka se waba abra na nka ne mre nson ye fi se ye hu ne se nka otwen kakra ifi 38 weeks ikono aya na boa na afezu so no omuni pedua na kwa bebre no etiminyi kama enioma toto enioma mu entini so entini so na moja toa no ayemu na ebra ne nka afi waba enti abofre biara ayebe wo ne sa time ni bia no ye ka ne se oye preterm eni obi baby sa se nje se ye wo abofra so na se oye 10 weeks so no so ye preterm ana because makoka se 37 weeks yes omo mu free wo sa eba efiti na wotwe obi ehu se wa fa nyinsen ekosi 37 pa cho da bi ebi mu ho a moja to an kra no enhye da kra nda ne nipa bibia so ati ase enti no mefa ne say to da bi eti meka ne say e free 22 weeks ba ye mamu hampo no empen pi nye de bia sometimes 22 weeks ne kra no be ba no omu ntimi nyina enso so ye fa ne say se bibia all things being equal bibia etoto na akwam pepepe enioma wo ho nipa ni nimde ni bibia wo na opa 22 weeks kona kosi 37 weeks we are preterm etimi show munya nkwa wo so nyi timi be ti sese ne yeso yeti ha sei etinye yare enye bibia ti ye ka preterm na se premier na prematurity sana na ye patche
okay ye ka se premier sana na ye patche Madam Donna whoever ana yatene nkanwa train mama ye hu se akra ye bewo no na before 37 weeks no and I say before I said o si chem no before 37 weeks no na ni moja to bibia nya enwie peye na abofra na ba no sa abofra no na ye ka se o ye preterm baby Dr. Rhoda bepe so the baby beka ho efa preterm prematurity ne ho ansa na ye beto aso de free ho no ma.
Okay, me da sister mama me akwenya sister me nka baby fa preterm no ho send your sister Donna kan no.
Okay,
so when we 37 completed weeks na so oba your friend is say your preterm but preterm no so ye omu ahodo bebre say ka say preterm you betimi achiche mu be enan first one extreme preterm
okay
omu ye wo omu before 28 weeks in Ghana sometimes there some way abortus but say sa abofra na sa fetus ne ba na so timi survive ya you classify in a camp preterm ho some way extreme preterm say babies delivered before 28 weeks and they all very preterm ne mofra ye wo after 28 weeks but before 32 weeks so within 28 weeks to 32 weeks na say ye wo abofra bia it's just abofra ne very preterm and then we have moderate preterm ne mofra so ye wo after 32 weeks to 34 weeks. So okwa abofra within 32 to 34 weeks that baby falls under moderate preterm. Then we have the late preterms. Omo die emofra ye wo before 37 completed weeks after 34 weeks to 37 completed weeks. Tisana etimi classify preterm babies.
Oh, okay.
And then they classify almost sometimes to based on their weights, no.
Okay.
Say omobana say abofra bia you expect say the weights no ebe within 2.5 to 3.5 and then 4 kg. Say walk around no 4 kg or no big baby or fetal macrosomia. And then abofra bia no say less than 3.5 and 2.5 or low birth weight.
Okay.
And for classification no your extreme low birth weight
okay
baby the weight no less than 1,000 grams only extreme low birth weight and very low birth weight almost weight near less than 1,500 grams.
Okay.
Then the last class babies weight near less than 2.5 kg. So with classification of preterm no gestational age na kind no together with their birth weights no and the boy me classify preterms.
Oh, okay.
And present host no shas no can something about statistics in preterm. Every year annually we have about 50 million babies being born preterm.
15 million babies.
Yes, 50
around
million.
The globe and
around the globe.
Oh, okay.
Annually.
Okay.
So over Ghana so we have about 128,000 of our cases. Almost more preterm.
Okay. And also every year no.
Yeah, every year Ghana.
I'm afraid 128,000.
No, out of all the deliveries that we have in the country.
Okay.
128,000 of them and they ended up as preterm delivery.
Oh, okay. Inti nipa dodo mbewo afimo ni nyina no. Yenya premi for 128,000 pacho sana tie. Oh, okay.
And then out of that no, the area say 50 million worldwide no, we have about 1 million of them are yelusi omo to preterm and its complications. And this makes preterm the leading cause of under 5 mortality. And crown munyandi 5 years. Yaria it me kumomo pa ye preterm and its complications. In Susan so I say I will be abra umre anso eno was stroke chain malaria any other infections.
Wow.
Nti e say preterm morbidity and mortality rates no very high. Affected public health. It's not just Ghana. Area still nyina preterm ya dia I was say ye nyina ye som na yetimi boa me mothers a omo wo mba omo ye preterm.
Oh, okay. Nti na chese ene na preterm na ya dia ha emofra ngeto apa chese efri be yawo na de kosi be 5 years no say or ye preterm baby a the probability say otimi fras as so ntem na very high patch o chima na anti dona den na ekoma sa de we say ba den na kofa sa preterm no edeba ai patch boy honum neka
yo patch me da se me da doctor so asipa woni nchichi modi amaye me gidi se ehwehwemu na ye ka no udi kan ba konti doctor ye no wansan fa nka ho se emofra 7 bia ye bewo mu bia no ba ko ye preterm ye shen ye nkomo na se no udi kan bo so nti na chese preterm no wo ka se eyade bia ehun hia na se yade bia ye nkoso a oboa eyade a ekoso ene ya me no ka se bebre ho ya wo mu as preterms isi ye ka se nkwara ye 7 bia ba ko ye preterm. Just imagine and then look at hospitals bebre be wo Ghana ha say just and ya wo preterms bebre ne kra yete ha you enti yen sambra o question na obisa say e de nkra na e ma ne koba say abofre nka ne mrenso ye na enso so wa ba asase so e wo nema ahodo bebre ebi timi ye abofra na nkasa ebi nso so timi ye maame no so ati ase oba tan na okura nyinsen no ono so enema bi o efe bi se maternal factors eno so timi eye ema abofra nka ne mrenso ye no etimi eba se waba asase so ebi ni se oba tan anase oba wa fefu owo mojabroso sa mojabroso no so yentimi nheda entimi ensi ano kwan yie nti obi ka se poorly controlled HPT in pregnancy. So what you say? Apart from that, so no, you almost so omo esiche yade. So obi o ha no wo deda. Obi won so anyinsen no. Etimi kofa ba. E dey ka se pressure no so no. Obi o ha no oni bi, but onyinsen ye no, etimi ema no eba se wanya pressure. Afi so no, ye wo bibi ti se pressure no, ninsunsu anso ba ko e say eclampsia anasa pre-eclampsia ebekwa kodru ba bi san say pressure na yentimi ensi ano kwan yie ninti no ma me na betimi akoba say enka lay person anasa yebetimi aka bibi say to de bi omutimi ya bibi say etwa so ahu eno so say koba sa na say pressure yentimi nye de bia na pressure no wo soro sa ebetimi akoba say abofra no abra ma me ne bibi e friend say fit anasa sa eclamptic fits ni mu no ebetinya base abofra no obeba so ati ase apart from that about time bebre anaso ma o mafa afuru bebre na nko clinic enti de ekoso woni padua ni mu mpo no wonim endru anka wo so onom na boa no na manyi nsane eden etimi nyin kama no omo nko ati ase afezo so yenhwe mofra teenagers mabunu anka omumre kra nso se wo so omo omo so afafuru sankrofo no so no ebetimi akoba se esan so no akasa ni pedua no ba tan ni pedua no enyini fonyinsen enti no body ne entimi mboa no e ma ne emfa abodoma ne nheri afunuma ankosi se mrebe so udu ba bia body na abeja no na ma bofre aba ne mre nso ye afenso so no e ma nso so a won so won fie ekọ omanim
okay
so ati ase eto de bi efri aduana ekọ yenka se efri aduana ekọ ntimi wo
okay
menka sa
okay
because me kra next year me ba be wo nenso so no sa nioma we no etimi ema eho kwan ema prematurity so birth no etimi ekoso but yati ase afenso so oba wa fa efuro sebe ononum nu bone kakra ana ensa cigarette ne nioma eho nhia na emboa ni pedua na afenso emboa manyinsen yeden enkoso eno so no se ekoba sa ebetimi abase abofra no ne mre nson ye nenso se san nioma o ye eka nipadua o de eka nipadua nti na akoba se e wo so oba afen so yetimi ye frɛ bibi se placenta previa anase placenta abruptio sabofra bia hye yefunu no ma owo nea ye ka ne se ekira de anase awode no eno na eboa wom ema mofrei omomogya se mo madidie na de ade se koba se eyi free baby e wo se na nkeda na beto baby fufura e de asema ba pasha yate ase enti no sa placenta issues no etimi e de ba afen so obi wo ho a menim se yate bia obi betimi afanyin sen o se doctor se yembra na yembe pam ma wode na no aha brofu yetimi ka se incompetent service obi betimi anyin sen obefa furo na so awode na no obi kan tebe om se ayemre enti uye ni na eja we pesa abofra ne ba eno so timi ma preterm na se prematurity delivery no eno so etimi eba so ena mofra na nkasa so ohye yefunu no mu no ono so eto de bia na enioma nkoyie ebetimi akoba se abofra na nkasa wo ni afesuo mu no if you say congenital malformations nioma bi enyinyini yie nioma bi antoato yie so ati ase ntine no na yesa na ono akora hyemu kra na wo ye ne na opeso push ba because anyin sen na sa ya bodoma no wan for me yie so ati ase ntine no etere bi ye wo omo a ye frɛ bibi se hydrocephalus even sometimes spinal bifidus be won say abofra no beba na ebia na chi ha sei no ebia obi oba ebia ne ti enti enioma bebre so wo ho na mofra ni bi so hye yafunu a yefre bi say fetal distress meneo any doctor yeti ase yenhye dan hu etore bia obehu say bia bibi ikoso sa but adekode pot e pamo sa abofra no kra no ebia unhu because obebi sama ame no obehwe oba clinic fine ni mfie no nka ye mfimfini ho fine onum cigarette onum ensa bibia da na kwan so na enso so abofra ne hyemu na kikikikikikikikikikiki ne home echia nti na wose yeyi abofra no so ema ne ba nti enu bi ho kra de ye kra ye nim kwan ye befa so a ebeba enso so I think say we ni nyoma kakra metimi abobo menim say doctor so de bi beso so a de ema emofra ye wom abranko omumre enson ye ti meja na doctor so de bia so
okay ansa na doctor de beso so no mpese ye kaya hwefo say ye stream live wo ye Facebook sounds ye stream live wo ye YouTube e on so ye stream live wo ye TikTok na TikTok be search THM TV Studios na Facebook ene YouTube ne de obesearch THM TV na obehu ye ho mpacho obetimi like na wa share na de comment nso aka ho na comment ne ye bekenkan e de ama na je said the yesi hwe na ye hwe prematurity and as a premature childbirth and premature delivery be no so can say premature birth and ye hwe na we are in the month of prematurity awareness and prematurity awareness month mo na ye ka prematurity ye pacho de ka safa ho ye premi and I say wawo abofra bra ne branson ye na ye hu sese ade a ha adwen pa yi eno na ekum emofra bebre na anka omunyanya 5 years grana say emofra ya wo modiko si be 5 years ye ka say ya re eku omo pa na say hawa ha sa emofra pa ona me ka say ye wo mo bra na omo branson ye no eno de dodo na ekwa asamando na ade a betimi abo ahwe na yetimi aye hu bibi eno nti na ye bo hu de ro emprempren na ye kai ya hwefo se ye se wa enso free TV ne ho na jedwa na follow yen na ye gidi se ebeye emwa e de ama opa na anti dona kasa no ama ye hu se de ekofa sa premature childbirth eba no dodo na de okan ya na mo wa kra ba ko yese se opemfo na se wo no monsa na wo sa fa drugs no ade ba ko a timide sa ha wo ne ba no nti wo opemfo na no monsa wo fa nu bone a ade a ebetimi ama wanya premi na obe ha abofra no na wan so obe ha ho nti ye tu ye ho fo na afa so de okan ba ko a how kakra so say over 40 plus now no so say eno ebetimi abase obetimi anya premium na nche eno na nche say obi a wenya 40 plus call intimi wo but the probability say obi a wenya 40 plus call na ebe preterm no e high na bio nso amaye hu say bi a mojabroso bi ana say omo an titru wafa ya furu na so onko hospital onko ANC modest Sheffield tonight na honom no no so ya dey itimi kofa prematurity na say premature childbirth no edeba doctor edeka kra ebeso so asam ye hu say bi nso kra na emofra na nkasa omo ho meti omo efnum doc pacho inti dey bio na itimi kofa sa premature childbirth eba.
Okay, from the antidonal canina the kakra me de be ka ho intrauterine infection bra oba na nyam na se onya infection bi to say UTI and I say chorioamnionitis infection I affect amniotic sac na e protect baby no so abofra ni bi ana mother ni nya sa increase in the risk of obenya preterm delivery and also multiple gestation to say obi nyam entafo in say mu bebre per se e won entafo it's a good thing. But there are risk factors, increase risk factor for preterm delivery. This obinium triplets, now we are twins. They are all triplets, no. The risk factor for preterm delivery is very high compared to obi onium twins because the pressure in the amniotic fluid in a triplet gestation, no, more than twin gestation.
Okay.
And then in conform IVF because. Yeah, instead say embryo na yeah just a single thing. Yeah, I was say far multiple and not baby. Until it can also lead to the multiple gestation, a better risk factor for preterm delivery. And then in our settings in low and middle income countries like Ghana, low socioeconomic status, and then it's me yeah dear baby. Cause some mama no say who need sika or the best shower pomodin ye. Unko antenatal until say baby cause of cry if you are now a factor for preterm no until low socioeconomic status and also increase or risk factor for preterm delivery.
Oh, okay.
Mothers who are malnourished, they are anemic. Need now so to make cause preterm delivery.
Dog and then council also said the anti dona kai and do now say or my teenagers are more faster and saying and no massa socio-economic problems in so at the bem no. Now Uche man any entire 47 so yeah there it's me ma we primi. Na doc they were members saying interphobia na ye premier na.
Oh, and yeah, interphobia na ye premier. Then ye Deacon, but most of them
okay.
Premature babies.
Okay. Radin sharp na anti don ampacho causes no purpose or sand we beka ho and I say yeah risk factors na so say into ye wo bi na ye premier na risk factors ni bi den den na emani hu.
Ye wo bi na oye preterm metimi aka se eye hu se nye hu sa.
Oh, okay.
Kane no na nimdie e wo fom na sebi nyoma kra de behwe mo frempo no de bi hye de ni ho aha enti se ye mpempem mu die metimi aka se Ghana se ye wo bi na so ye preterm eye hu die but enhye da nye hu.
Oh, okay.
Na nyoma ebema aha adwin bebre asa mofra no ye de omo compare mofra anka omo mreso ye no omo enia ebi ni se sa mofra no bebre no sempo obetimi senka ye fe bi se cycling refresh so se otwe nufu ana se omo ko ade mpo no omo de wo fom.
Okay.
Apart from say no wo fom no se omo ni ade nso no eno so no swallowing reflex eno so e wo fom isa amofra no omadidie eya na eto tima kakra te o se de bia no ye support wo ti da ye stress mamefo no omo manufu ana se mpo no ye be pass tube bi so ahu ni ye do maduani afam afi so sa amofra no so no omo breakfast et le bi so ye ka bi se hypothermia.
Okay.
Some of an bebre na beba no obehu se ye wade post tissue e wo obi a scan yase omode no ebi kura beba na ebi ni ho depending on time a oba aha obi so kakra bi ntini emomu ntimi and regulate omo temperatures nipadua no entimi enhwe omo ho hye na omo ho nyunu no entimi enye ni yie nti wani ba ho so na ne ho ayunyunyu oya so oboa ne pese ne ho nya hye na ne ho ayehyehyehye fi say enioma anka beboa obi say thermal regulation no ebi nhye de ni wonte no so ya nada risks ni bi no apart from that no so no some of akro ye esan se omuntimi enmoko ade no ntimi mu no eminenti no da bia na sichire empempi no eya na wofom sa na me boso nyina ebetimi akun mo simple but ye boy rade mpa ye ne adwumaden ni nimdie enti no ye hu se eya na owo ni time apart from that no so no some of akro ye omo beba no mo home eto atwe because lungs na ahrawa no enyini yie ahrawa na ntimi enyini nti no no nkasa no obi kan wo so wonde ne ho no o se ba be ye adwuma ye hwa ahome eye adwuma pa enti ojai se obedidi obeyese na ode ni nyina akohome a wele ba ho so na afa ni nipadua ne kra no abre sa amofra no be ho so be ba no home atape enti ya ye boa wo be ho so ye de mframa kakra esi omo so so ati ase e fa omo temperature ne so be so be ba nti wohu abofra bi a pretem bi abekọ ba bi a ye hwe omo no na mo hye machine bi mu ya ye friend say incubator ye de sa amofra no so ehyem na bibi nso ye friend bi say apnea so apnea no ne chere say ono ankasa won home no they can say omo home to ape respiratory distress e wo ho so ne ye san friend bi say apnea ono awon home no ni rate bi free no ho sese sia no ni maame yem owo ye funum a enka ne maame placenta ne eyi no ye friend say cord no maame no ehome ma no o san produce a lot of red blood cells no so no e carry oxygen nti just say omo nshada anya hwe to mo ye nya wo no mo bedura ya no mo refi omo ho so ahu nti niam bebre omo ntimi nye to no otimi home abi ho ase waja be 1 minute 2 minutes no da ho ya na ye nika say but ni nyina ye nioma ye say sebe obi kan say enye si nimdie na aba ene nimdie nso so ne ye won krofo ye nso so no ya tiato ye ho say be hwe sa amofre ya omutimi just like that but nyame adom they say ye sua ebi anso ya ba ye bo hu da ruri ena se ba nioma ye de hwe omo so a they say nyame adom bebi mpo ebi ni no omutimi ye ntem e de ba bebi ebi wo e ba sa amofre ye timi so omu na ewu a Dr. Deacon kan ho asem sa over 1 million no so ahu na eso tin kakra enim se enche eso beti eguso ti bacho meja na doctor so EDP access
na so tin kakra na na doctor dey be so no na ye pese hu na doctor e ka risk factors na on kan fa physical features no as na anti donor so e ka bibi sa fa physical features no ho se ntimi hu me ye ne empo tissue da say adipose adipose na e be regulate temperature na any hono ye no nti no ni nyina ya ade I think say it will be the features of preterm baby nti doc patcho o my risk factors ne kakra na ka what the features no and I say physical features no being so ka ho de am
okay. So just to correct something, so say the age near complications of preterm.
Okay.
Risk factors in ID can say twin gestation, multiple gestation. So the anti-donor can about feeding, any weight issues na respiratory distress na complications are it's me ba with the preterm just because you are a preterm no. What means those complications?
Okay.
In sabophobia or your preterm, over confessed in your size no. Looking very small. In the extreme low birth weight that once your cranny weight no. A loaf of bread crab ever so chain. Send ye a caranity. So we show more looking very small and tiny. And then their skin too looks very shiny. And then it looks rubbery because need enough adipose tissue Nancy. And sometimes you can see distended veins or body no home. And then another thing say hair and yet the normal hair 10 babies were. You know your friend lanugo hair. by kakrebi and also. And then their genitals are underdeveloped, especially for a man. Which are almost scrotum ne or more pennies, very small. And to say or compare baby or drew the time so yeah. And see back to their complications, preterm babies are prone to infections because they don't have a matured immune system. Almost time and antibodies say or say a bomb more fighting infections no. Our form esne 10 babies so compare or more. Then another thing, so you're prone to congenital heart disease. Your condition be a friend of patent ductus arteriosus. Yeah, you're trying to show it's a friend in PDA. So PDA, ductus arteriosus say a corona or your pneuma. It's a valve. I connect more heart no to the placenta. Send the baby oxygen-rich blood to be distributed to other parts of the body. But it has a time I be closely. So we drew term na ya it closes on its own. But because the way preterm what time man so na ya banti. Some of them enclose it.
Okay.
Inti ano so bana say access baby no or congenital heart disease nibia. You want the management and then still with the complication they can ho asem na respiratory hypoglycemia, hypothermia ni na short-term complications. And then for extreme preterms, you are dealing with a friend intraventricular hemorrhage because their brain is not well developed. Capillaries na a type of blood vessels no, very thin and then sometimes it can break easily. So for extreme preterms before 28 weeks and then 28 to 32 weeks, very preterms no. It's me mamoja age na or mutrimu. So I know so your idea says if a baby has that the level of consciousness echo form it's me my sure I can't about frano and then if you don't manage it well we can lose that baby. Then for the long-term complications no so baby no your friend baby developmental milestones I try say akara already 3 months it's me I was still on your neck control. By 6 months, some of them can sit without support. Now, deny or send your base 9 months, or send your bottom shuffling, or crawl. Now, by 1 year, or so I demo now or to 2 9 back. Preterm, sometimes or more than a delayed. And just so months mean attaining those milestones, no.
Okay.
But as a mother, you have to understand, said, so baby, never check a car. And also another thing, and then retinopathy of prematurity. They have it's a condition that affects their eyes. And so say ye abofra ya discharge babies nibia we have a criteria. So baby need fall within that criteria. I will say assessing for that retinopathy. That's I will say a draw. You're treating immediately without waiting for the baby to develop the retinopathy in their later stages. And also with their cognition or school learning abilities no. Sometimes our form kakra. But we have some preterms or we are very intelligent. Ni na jina say na ebesia manage omo in the acute stages. Say a wow bofra ne ba. Say na ebesia managing omo no affect omo progression. So when managing a year, some people even end up with cerebral palsy, which affects their motor and then other developmental aspects.
No, my person, and then I did how to manage it. Not just a wab for preterm, you beat me, I manage ya, say, a bema or no crown, a be a young who say, oh, yeah, preterm baby, and I'm patron to sa. In ten and I'm patron, quite benny, a before so you beat me, I manage a yes, I preterm babies, no. As a matter say, now what I say, Casafa home, and said you was kind of go crown and cognitive no ever from an answer, the intelligence ever from due to ABS preterm, yeah, and I say prematurity, yeah, Mama Matias, yes, a binomon so bright, a be intelligent. Intinasa nipa ye bit me I say, on one genie ye intina mana bayesa na netesa and na saying I see a manages preterm babies, no.
Okay, see the management of preterm delivery and a preterm babies, no. It starts from before I ever walk frano.
Okay.
Because we notice that some of the risk factors, they say hypertension, then uncontrolled diabetes, you're detecting early during pregnancy. It is a schedule be say CS to deliver the baby to prevent the baby from having fetal distress. you have to give steroids. They said hexameters, so steroids never with their lung maturity. Because we've noticed that if you give steroids within 24 to 48 hours before delivery of the baby, it reduces their respiratory distress and also reduces their whole mortality about 40%. And also you have to give magnesium sulfate for neuroprotection in some of our mothers with preeclampsia to now protect babies before delivery. And then during delivery too, we have essential care for the newborn baby. Our doctors and then nurses, the midwives are baby. Your protocols I will say follow.
Okay.
See we have to keep the baby warm, help them to breathe. Into say now before delivery too, you're supposed to inform your pediatric team. No prepare awaiting the baby.
Okay.
Because we are going to keep such a baby in the neonatal intensive care unit. I have trying to show say NICU. Into abofrane bar, you be manage complications no. First one, there are issues with thermoregulation. So abofrabia ba no a preterma. You're supposed to keep the baby warm by using an incubator. Until the baby never share incubator and not boil or more with their temperatures. And then sometimes to about for Friday, they need to radiant warmer before we transfer to the incubator. Then
me pese ye hu incubator na ne se de city ntinka ye MCR for wait me the incubator na to so an say ma bra doctor can suffer how to manage preterm babies nti doc naturally say ye wo be now a preterm baby a e betimi manage e bi ne say ye de na incubator answer na mo de we ne be screen so no mpacho to aso nti ye incubator
ne bi ni so be ba ye ho okay University Hospital no we have a number of them babies never okay. And then those who are we also have KMC. Your friend of kangaroo mother care.
Okay.
De abofrano, mommy and papa and any relative who is available to support the parents.
Okay, I think so. No, so pictures for how you wait me at demonstrating. MCR wait me the star pictures and so at for mommy now or they nebana share nebosono and ne kangaroo
mother care but see our fathers living so yeah KMC it's not just limited
I think
to the
my
mother
father being so no okay oh I see okay
it's the KMC nature say yes she shall carry with just light clothes but you the mother or the father no what the neighbor show no phone term
okay
and it helps say or more heat regulation no because warmth no e be can abofra no and then it also stimulates them to breathe that apnea dey can ho asem no
okay
your KMC baby no ntanya apnea because as the mother or the father is breathing no it stimulates abofra no more no so ehome
okay
and then KMC is also important because it helps with bonding say akara no dane mama so or dane papa so ni na okasa
papa ya adio okay
e kasa tre abofra no
okay
and it also helps with their weight gain.
Okay.
Because so the DA now the initial one man. So for thermoregulation, no, KMC and the use of incubators.
Okay.
And then also with the respiratory distress, you can say because their lungs are not well developed, your substance be your lungs near friend of surfactant. And on I say around 28 weeks to 32 weeks and the production in the body by 35 weeks we have large amounts of the surfactant but because most babies come before surfactants near enough ninety and your ammonia respiratory distress no and so if you can afford surfactants now we have medications for honoma yet me there's another medication a friend of caffeine citrate so akwara or preterma the more to help with the apnea any respiratory distress no and also we have to give oxygen therapy depending on the level of the respiratory distress but we can say I can't respiratory distress na nyoma be na dead our friend no be ba home intentem we counting the respiratory rate na was sure who said ne home no baby and the ribs no one I can't come no who say abofra de ne home ne obi on so baby and trachea no we friend trachea tag no who maybe who say a can't come so those are some of the signs I share in babies see more oxygen we have the CPAP higher continuous positive airway pressure I know say mfidie machines are dey support babies no ema omo home
nti na chese se obi wo preterm baby a nipa no ye betimi manage ne ba na ma chese obetimi anya ahoden kra na de ye kekan nyina ye niema etimi ya eboa ema sa abofra ne nya ahoden pacho doctor sa na tie
pacho nti se say preterm enye hu to say kane no biom
okay
because mfidie ni knowledge we have doctors there any nurses ne midwives omo boy ye ma ye share preterm babies. Another complication I can't want them here feeding difficulties. Auntie Donna can say to me and sakoye and now almost swallowing no so ever form. It is say oh baby yeah assess so depending on the gestational age almost very preterms no. Sometimes we have to pass a tube for feeding. Your friend NG tube. Yeah the best form of him so almost stomach no. So never as a mother in your breast milk. Yeah the best tube no na ma no. Then every day we'll be assessing say is it improving. So the time I wait me YouTube no cry I'm about frana coffee. Then we also have cup feeding for mom we are very stable now mutimi swallow kakra no. See mother no the akra no better to no fan. I no interested say akra no share YouTube and I say yeah cup feeding I don't fan to no cry. You still have to let them learn how to suckle, but it's just that it's with time.
Okay.
Until before mother no to be breast milk no. Yeah, they so AC almost so. Sugar dextrose to help them whilst we are waiting for their mothers to start breastfeeding and then giving us breast milk. We encourage the use of exclusive breastfeeding.
Okay.
For preemies, we don't encourage the use of formula feeding at all.
Doc Basho yen kan she ni ye pa hanum say no nti say ye ma no for ankankane o ma ya wo mo preterm no ebi no mo say preterm for there be mo no for crowd nti pacho yen san si honom na so bio
preterms the omokra no mo hia no for nko sometimes our mothers are worried about the weight but we are exclusive but we've seen results so we know what we are talking about. We've had some patients who are twins omo ye preemies and so okoye exclusive obeba no 6 months time who baby na won't me identify omo crash and no ye preemie because the entire say formula feeds near for preterms omo guts nene omo digestive system no and yeah well developed but they for breast milk and kasa they are able to digest it well.
Okay.
Formula no issues infection sometimes the way you prepare no you contaminate the crown sana akọ guts nim and say also say infection body no will try to react sometimes they get some complication on necrotizing enterocolitis. It's a surgical and medical emergency. So one ban tell mama initiative management for such a baby you may lose your baby before even coming to the hospital. That's why we don't encourage the use of formula feeds in our preterm babies.
Sinache say chirima say oma no konkume aduane ya say ye konkume aduane ne de oye primi ba ende yemfo asokwa na say yenso so ye kire say ye mo ye homoden say ya awofo no emma ne titru ebema oma ne no fo nankankane ona ya wo mo preterm no Dr. Adin Sharp na you perceive how to manage it here. You perceive nya measures are be reduce a preterms and I say you perceive who kwanya a bit me afaswa you better so and ne soon and so any complications are hodwa a year preterm ne de ba antidona pacho boy or honum ne kakra kwine ben na say ye hu a fa premium ho kakra ye hu premature birth no childbirth no ya hu afa ho kakra nti ye pese ye hu measures are dey be reduce prematurity no and say premature childbirth na ene ho complications nyina no mpacho boy wo ho no ne kakra
mpacho me dance kwaye be fa so ebitimi ama premature delivery ana prematurity rate no akofom no obi kan ebi wo ho a enye ne ewo me ne wonsem nanso so nipa afam die ne ye nyina yebetimi aye ne se ye fa mabunu a yebetimi asre se enka babunu bia benya abotre so ahu na wadu ni mpanyi fie so ansana so peso ofanyi nsempo a ofanyi nsemfi se yehu ne se wankasa na woni pedua no unyini ya oyeden na otimi san hwe nipa foforo afen so no na ye sre se ekoba se onye mabunu onye babunu ana empo wo enfie a ewo se otimi wo a wo fa nyinsen a wo fa efura e pa chobra yare sabia
okay
emfa ntina fie so ahu obi o se na me twen kakra de na wo twen mofra no se edru se omoye mujato na omo nyine na ewo nuro ne enioma bi ho a wo se ye de hwe ye de hu omo nyine se na bia bibi koso a entempa na no ne aboa so ahu na abofra no watimi ahye ho enyini kama ansa no waba afenso so no umra so ana wo enfie a eyemu oba clinic fine ne ye kase ye no udi so so ahu obi ho se ene ye se mami ndi we me pa cho oba tan de utimi di bibia na emomu no empempi ebetimi akase de okondo ene de ebeboa ma abofra na yeden etimi anyini yie enti wadidiem abra wafa afuro e so hwe wadidiem yie make sure say aduane a wodi no e balanced diet bibia ewo na akwan mu toto na akwan mu kama afenso so wo chronic issue bi ti say HPT ana say diabetes esichire yare ana yan pressure ya mesre ma ona nyentia eto de bi obi ha oni pressure no na emom no fa afuro no e na pressure na ba enti ya na bi mu didi agrobata ye hu pa enti ye nya kire o se ye kikire won sa no ai se o pressure no wo shoro mesre wo fie na o te se o tipa wa na se o hu bibi petru mi kana bra yare sabia
okay
en twen se o ba ye ne se bra in 2 months time enti no te fie da bi so ati ase enti wo ya sa so a eno so no ebeboa ama sa nneoma we no so ahu ye ka bibi ti say risk factors ye ka bibi ti say placenta issues cervical incompetence sa nneoma ni nyina no so ba ya resabia ye be hu ni ntem ne ya boa okra so what meaning so what is obi afa efuani aka che ni say no baby no home obu etimi ka che so be da hospital sa ko si say obewo obi nso so etimi ka che o say adwuma na wo ye no emwa enti jai na tena faako ana da ho saa so ati ase enye adwumaden kukukukuru neoma ni nyina ye eneoma ye din hye ye di gu akwan mu na ya boa se abofra no obetimi ahye ye funu nim na ne wo se onya bia no wenya na wetimi anyi ansana waba ame ya wo no medical aka eneoma ni bi wo ha enimi nsem nsem sanso so na eni doctor nsem but nipa fam de kakra metimi aka no udidi yie
document so me pesa me do we ka ho se lo so ka ho a ene omo so a wafa yafunu no no monsa no njai ana me
pa ni me ka se bibi bia wudi bia no enya ade a ebo ne pedua no so ahu e wo mu se yese de okondo bia di obi ntua penfo bibia se we de untimi endi we de untimi ni ye nhye de ntua sa at the same time so no de odo okondo anaso akono de na wudi no hwese edi sunsun aso papa ma woni pedua no ene abofra na onyini no si etimi yesa anoma we di a na ne obi brofo mo se humanly possible ne we ya fam we betimi aye nko we abofra watwen wanyi kama so ati ase wo fa afuro so wan tena fie baba hospital endra de ma so wonnom wodidi yie so ahu ye nka se nyinse enye ka no ka se bia mini sika da bi de na wudi na but wudi ne kama so ahu se ye ka se bia issue bi aba o pressure was so wasi kire ne kosoro embohu
okay
so ati ase embohu fa komapa nti doctor menya dan eto bi esa de woto enuro fufuro so eka apemfo nduro na wonom no mesrew empa aba
okay
weni obi kan o se abofra ni ntina utu sa na moyi enti onya mpie de ade na wo pa aba mia wani na se ne ese ebe nom no nom time ese bra ne bra time ne nso ye na wo si ni pedua ni ne ma nkoyi a enti na fie yesre wa se no so be den obeba na bibia aye kama
that's anti-donor right and I didn't show up now obi e dey about say what should I consider before I can conceive as I'm getting to my mid 40s then I saw bra or person of fair for bra or keka ko ne 40 years me and then I say or consider never be na so consider but you be here no na obi nso e de aba say e den na ekofa ba ema abofra. I want to know the reason why a child comes with asthma. More times preterm babies no be why say aya na omo asthmatic and no sanity and I said den ekofa ba entie kan ta dog be boy wo na antidona.
For the last question now can
Entisa.
Okay.
I think in our society sometimes there is almost can't asthma omo be who say machines is our friend one
And now man oxygen cry.
every form of respiratory distress asthma.
Oh, okay.
But our babies almost respiratory distress na asthma na cause.
Okay. Okay. And then for your first question is auntie.
First question no. First question no.
Okay,
I think
40 years.
I empo enya no me de ba sisi mi kan bi say ebi o ha ye obi humanly possible.
Okay.
Ebi so ho a enkita won se me enkita mensem.
No correct.
Doctor so enkita nensem. Enti mi pa cho mi nua samre ukeka ko enfie aduanan mu. Na onso so wani da so se o pese o fafuru. Ya metimi aka ne se sisi a menim se wa ware se wo ware ye mintimi nche. Ena menim mre dodo onso so a o pefuro e dia wo ba. Na metimi aka sisi a ne se obenya gidi onyame mu na afi wetu anamon akọ ayaresabia.
Okay.
Ye African University Hospital na eba.
Obetimi
aba ye wo specialist. Ye wo guy ni fo bebre kukudam wo ho a. Obetimi aba omo no ebeto ensa na mo so wonsa na ya hwe kwan ye betimi afaso na ya boa na wo so no wadane obatan.
Okay.
But ni dodo na so kita e wo nyame nsem.
Okay. Dodo na wo nyame nsem se de anti dona e ka no. Enti unya nyame ha reshimu so a ejiri se yankopon so ebeboa na aye akoma so ade na ede ama. Na another question so how do I care for the preterm after discharge into ono awo preterm baby kwan ben so na obefa ahwe no nti doc me pa cho boy wo hodom me kakra.
Si so wa preterm baby na ye you ya discharge wa ma wo kofia. First thing KMC no enisa ujai.
Aye.
Obi o ha o kofie o koja akwara na to ama wa akọ ni mu dabi. I was so hye baby no ho to help with their thermal regulation. O hye ne chair socks nensa ne o so the baby hye nensa. Ti se ne ye papa ya e wo ye television ni so. Nti wo ye KMC o fia ni na aboa o baby no. And another thing infection prevention. Enya afi na wa preterm a wo kofre efie for so obi ambesra dabi. They can come and visit you, but they shouldn't be touching the baby. So we be far about front crowd or so washing and sa. Obi or baby or nam wa chia for baby or buy another be so preterm baby no. It's not advisable. So if people come to visit you, you can be with them at one place. Now baby no so that ne room. If you don't want them to go, yes, or be banana or bow no so. It doesn't help.
They must not be too exposed. Then
Jeja mama obia karabia na obeso o preterm. Obia ensure say your hand washing very very important. And then feeding no so.
Okay.
Before you go home, usually calculate amount a baby no here in a day for breastfeeding. And so as you are putting the baby to breast, you're supposed to do express top up breastfeeding. Into your amount of quantity, this baby can tolerate 15 mils to 20 mils every 2 hours. Since she say our doctor the no. I was still with this so. And it's all call overfeed the baby no. Say because so person weight never and sense. Call overfeed. Some of them will aspirate. A journey now no. I feel everyone the home and cry content and now was back to the hospital. So you just have to follow every instruction I had about. Then follow up after discharge. You show dates. Initially for our premies, sometimes make us say every 3 days we are co-weighing. Then the progression of the baby's weight. Kwa mbwa obeba na fe de akwana ye malnourished. See you show dates say also about follow up visits. Please ensure that you come so that if there are any complications during you being at home, you make me detecting in that aspect. Okay. So that's how you care for your baby at home after discharge.
Okay. Auntie Donna will be so dear, but their questions no ban never my pound. Or say on our preterm baby, but Nikunu supportive. Or one in Chencrassy and no casino to all nippers had on your thing.
Yo, my sister. A young homity baby say. o care for preterm preterm omo care no enda form se wo hwe obi a wo preterm no enhye da enda form sa enti daddy we dey yesrewa kangaroo fada KFC eye de papa enti yesrewa se onso ya obeso yemu kakra na kangaroo no ukofie na se wo ya Dr. Bosso abribia e wo sabofra no o hye wo bosa so ahu enti wo yi ne hu nyina na ka ne diaper ne nko a na oyo ba o hye onufu yintem ha sei na wachechire na boho na wahye watade egusu kama abra ebekoba se untimi nye kangaroo ya abra ebia u senior mantu kuntunu mu so ahu eto da bi mpa se wo da obetimi support wachi with pillows na bofra ne gusu hye ho enti daddy wo de untimi nye bibia ma ya KFC
ja agi akra ne
ye KFC ma ye fa ne hye okoko na ya chehye na bo wo hwe TV utimi de ne ye wo ye ko wo nanti fie na de ade ne nyina obetimi hye wo ho na waye afenso doctor eka bibi fa management at home no na or come about feeding ade na so come about aspiration ade pa pon ye hu pa edi mofra ni nya eye ye free we say aspiration se wadidi na atram no empo mofra na omomre aso no omo that issue enti akoba se preterm no no na medi kan no hye ne mama ye ma onim si e bibia ama no enti wasan ba still no was mentality no preterm we be ko munyi kura ya so mo ye daddy beef o just say
okay
so time mo ba enti de bia o ma ne nufu abonachi
okay
bonachi kosi so obegu so emane nufu na emfane nto ho yesrew emfane nto ho bonachi ni eye kra ne se wo de ne hye obona anje se o hye ho ano no so ahu eno no emane oguso a ebi enkofa ne hunim ene bi enkofa baabi na wakwakowu anase ama ne home no asa akọ back to distress
radin sha antidona pa na ye bra ne sa ye be fa calls and so na message is saying and this is from More Editing. I say this is very educative. God bless you for today's topic, Mr. More Radin Shao and antidona ne Dr. Rhoda More fans who have on Facebook. I see go girls. This is from Betsy. I say mensa. Adet's blessing. I say God bless us all. Maybe also Abba mensima. And also say God bless you all. Daniel Kotoka. And also say God bless you all from Pandai District. I didn't show up. Adet blessing. I say is it advisable to expose preterm baby to early morning sunlight? Me jidi say no. Yebe you are no. And Ajwa Saki. And also say Mama Ru all the way. I fans ne papa Radin Shamo. Good job guys. The whoever in the building. Not just say fans na Radin Shamo. Na you have calls into but there is a question into Doc Road up a big question and my bra you're trying to for into Doc Pacho you question and my 9 license to TV so
the car say or exposing preterm to an opay. I don't know her reason for doing that though, but we will not advise that.
Okay.
Say if it's about jaundice, I won't find in Bra Hospital. Because I think that's the reason why sometimes they do so more exposing it to area to clear the jaundice. Jaundice, no say a level. We have different levels of it. So the baby never taking a sample for the serum bilirubin. So depending on the level, you bet me the natural light. I say I refer in phototherapy. And I say in severe cases we have to do exchange blood transfusion. But if the levels is minimal, it's breastfeeding. We encourage you to breastfeed because I know I clear jaundice free baby in the system. But if a reason for exposing the baby is not because of jaundice, now for other reasons, we don't entertain that. You're supposed to keep the babies warm. Because in yes, they be on baby with hypothermia. Anytime we are baby, and any temperature no.
Okay. Yeah, best MCR so on far lines ningu so bra afre phone so afra badjumedi so mpacho question bia obetimi afra badjumedi so it was 0597724291 0597724291 and I say 0203903749 mpacho fra any enkasa mfiri phone na obelowa TV set na e dia mai nti ye frɛ ye twen afre fo antidona e wo bibia obepese oka editwa toa
okay nti ade ba ko Dr. Bosso nemo me pese me pense mu kakra se o ka se enkrofo be fia be pretense na de ade wan kasa maame no so na wo so make sure se de bia no wa ho siesie di mu pan yie titiri pa no onsa ehohoro so e say covid adaroma nti o sanitizers wo ti e be se de bia no ohronsa ansa no afa abofra no
ohronsa ansa no afa abofra no ye call out the kind me pa cho din ni baby out free. Hello, Mpacho Dean, baby. Good evening.
Mpacho, yes, I'm very cool.
Okay, Mpacho, my answer.
Mpacho, in any pregnancy, yes, tuna, and yes, I'm not calling up in the premature. The person is true, tuna, and yana for about early.
Pacho, Jina, you and I ain't too on and meant to ask him. Was it
tuna fish?
Tuna fish, I had a.
Yes, and yes, oh, be our fire for every tuna fish, and yes, a man is prematurely.
Oh, okay. There, Honum na made here frinty. Pacho doctors in the bay you are no. Pacho for flowers, and Pacho Dini baby out free. Hello. Pacho, you been on my line. That's when I JJ text message and WhatsApp message in quaint. Yes, I'm on free lines now. A war yellow, now the blue at training. I know the offer. You bet me, I can kind. You bet me at one can I. Although messaging so far number, you bet me, I can kind the amount. A bright train for any dog babies are accept nanoa. And auntie donna. Pacho, yes, tuna flakes. Over say what fire flung what and no crave woman say.
In fact,
Hello.
Hello. Hello, Pacho, baby, free. Went to me and so.
Menye dietitian and I mean nutritionist, but in fear kakra me ba apomuden adwuma mu menyanti wo baby ase yese oba wa fa efuro ewi tuna etimi ma na wo pretem empo abra me be ginim de de hwe mofra mpo no menyanti bibia asa
okay
intimi insisu dua chenchena twan se ampa wo wi tuna oba pretem na asa wa anwen so a ebebo ho ban There's so many bibiasa, nim de biasa. Minyanti hu bibiasa. Menti no penyi semda.
Okay. Into said auntie donna can onya bisada. Hello, me bacho dini baby out for free. Okay, mpacho din. Okay, mpacho my auntie onka.
Me bacho Prematurity.
Online ni breaking think out to me jina ye kakra ma ya. O question no Pacho my auntie onka ha. Afi mu ye. Line harding. I'm Pacho be kono asam baby wa yente onka na question nso hu hia pa e be pese e be you question nso ano. Tim Pacho sen ka be tim sound for baby wa. Hello. Intina say question na dey kan ba yen dey yente wi so mpanyin sem da. Ana
yes sister question I say kakra me tie no kan bi say wonye be 3 months bi nim say sa na me tie ya I so ntimi ndi I just said don see mo
star
bibi sa na me tie me nim say sa na no pa chere dia
okay
ti no bi sa say bi obetimi aye ho den ampa empempi e fe bi say first trimester
Pastor bi abanti na yen for
Good evening. Hello, good evening.
Pacho dini baby akase free.
Make us say any name the doctors.
Okay, Pacho my auntie onka.
Pacho, for the me baby now 6 months, but no for the group.
Onum bio.
The mama on GP. Yes.
doctors be you and ye kasafa pretend mpacho no ye pretend baby ana antimi anyina so dog pacho minim say abofra na ye pretend baby ana so onye pretend baby ba wenya 6 months apa ho onye until the ono so ye be na sembisa na next call mpacho di ni baby offer free
Beba Antirita na Mansayamba.
okay Antirita mpacho ma yento nka
Me say my fight ye phone bo so me
okay
na aduane na me di na ti say apart from modern PC me din so na me position me
untimi ndi aduane na ade nyina de utimi de ye body
di
udin so na abo hyehyem mpacho sa na tie alright line ha mpacho eno no asembusa
that's fine
okay mpacho doctors be you and why offer for hours mpacho dini baby offer free hello yeah brana yeah bra santi answer yeah try last call idea do pacho obeyi sa ensemusa ya bayana anti dona pacho obeyi
I think say we dey na nka ye ka ho asenti o se body ampesi e nipa ne se otimidi enti de metimi aka ne se yampa etimi yesa aha but de obetimi aye ne se body ampesi na odi na ne bo hyehye no ondi no nkakra enti se bia odi mienu a on bu kakra bi on resa enche ansana waye dey wamene afezu so no odi kakra na on tena se mane ndeda ho bebre so ati ase on tena se enche kakra ansana wasan eden a try se no se wose no pen otimidi etimi basa so ati ase enti no on didi obi kan say obedidi in bits en kakra apart from that no so oberesa ache so ati ase nti ubu body kakra hye wanuma on resa no tesi amene wesa mane mfepa na watobo umene a nyabotre na tenase and that ho bebre so obetimi asori na tenante kakra so a no waye uwi a no wasan aba nti aduane kakra no beche wo ho but obetimi adidi kakra
na mpasho the other question
ba ko no so no ono so ebisa se ne ba nyabosome nsia na se enufuo no abofra na jai abofra bia ne se no te bi mu okro mo pakra de nufuo no mo no mo kra nti se sia na wo so hwe kwan ben ne befa so abofra no na didie no ebetimi akọ animu enti obetimi ahwe efie nuane ya yedi nyina se wonya bosome nsia empempi mu franya bosome nsia yede enuane ehya omase enti won hwe bibi obedi ni koko na de ade no ompe koko plus so ho enka ho eno so beboa na ebeba na pomodin no so SCP esita
eno so beboa ma na pomodin SCP esita anti dona weber ana yenya no we seti so na wayen shama ne pa or pediatrician or pediatric nurse as a mayor to post you anti ene se we dey obeya pediatrician this now anti dona weber ana or pediatric nurse or university hospital KNUST hospital ana or nurse or honom na your doctor Rhoda Edusei also eba show you so and o my instrapa amayen Dr. Edusei MO with pedis and as a MO in pedis na my insha edi amaye pan ka say ready strong and na dream for a prematurity and a premature childbirth and as a premature delivery and no ho asem na kan na and then I mean I so amaye insha pan o ma train and they afa a premi ya ka premature childbirth na mpacho do na say the sika no ye hanom nge premi and as abofra ne brown so na ya wo no abofra bebre na so kan say e de na ko share incubator some friend and near come who as him. Nay, who say, Bosumia, a woman a year, November in I, a Bosumia yet to a siwa. Ya de bossa, dear, who de runa, ye, de say, Utmi manage some of Rani ya, Mansus near Crampo, and Meda, some of Random Pony honor, make us a homo person and sana, ye woman and put interminty idea with me near Boa Amasa for no, it's me at nas and near Chessa de Acide and quadrati through Oma Yawoma de Cosi in Fienum air corner, air qua some under a idea hard ring. Ye did say the Uba boy and who did I ye a idea a bit me aboa amaya sosa adiana nona ama emfa and quadrado dona and co womb and ninty and ne na de casafa and eradin shaw so jedra now share na ye fasa quenya so a shy asaf mark and the phone and answer no Dr. Rhoda chia adofo kakra na anti donor so chia adofo a na ya chia na ya sorry show ne so.
And I was for this opportunity. I don't quite show me a co-worker I know more University Health Service.
Okay.
But my boss, Dr. Betty, or follow a power page, so Dr. Sen and all our other bosses, and then my work colleagues. Currently, I can see that my family members too are watching me from a soccer mom phone. So almost a mutual for supporting me to be here.
Okay, nice. Na anti-donor. Also, watch out.
And so Miss Medasi were Quenya Modemai and Nessie and Bebo de Rue. I send back on a person mechanic same patch or 4 ye or pray 10 fee. Miss so I resabia bia honor. Some rebel so me November. Ye bought pretend who de Rue into be bia. Uncle Saya resabia ho. Okwa neonatal unity honor. Omo betcha mo she KNUST nyame adoma bosumi we 27th yenso ye be hia san krofo nyina ne abo edwa kakra na ya ye nkyerɛkyerɛ na ya hwɛ wo mu a ya hwɛ wo mu ni nyina wo mu betimi aba no na ya twamfoni na ya tonsa didi na ya chiatia ye ho enti ye obi bia wo preterm child bia se wanyi so aye den Mr. facility a hospital bia wo no ye stress mo be kɔ hɔ ya na ye nije pa so mo be ba ne nkware bia nyinyi chese eya na ye nije nti pacho wo obi sa ye se mo be ko munchi na ye nnuamo ayaresafo nso so mo ho no omo so mani age no mahu dwuma omo ye ne so mfa so aba afi so ne mechia KNUST se ne sister Deacon ye no pediatric unit ye dos papa ene ye director ebio na afi so PSG na ma sorry for bom so SDA for and I feel so me sweet tata me ne buy
Auntie Mene.
Nana aba Adomo Foriata.
Okay.
My one and only.
Okay.
Baby I me na neko.
Sure.
Enti ono so me da na se pa wo. Opepa wenya baby I make education bi odi mechi.
Okay, nice.
Enti ye mo so ye da mase se moto nsa frɛ ye.
Yes, ye da mase.
Yes, ka se abribi am beto nsa frɛ bia so no. Yapono ebie ye beba na ye de odo abebo odom na ye ye ncheche
eradi shaw pa ahonwe ho apa say to ye nsafrɛ mo so na maba na ye chia ye apostle Moses de Genua wetepe ene sof maame dan na ne abusuafo ni nyina ye ka say eradi shaw pa da de akonya nyame na mo so ama ye nyan eso ye ni bebre ye ka say eradi shaw mo ne prophet Richard and Papa Heaven on a of Mammy Gloria and Yabusian Funia Radin Sham Sans and General Secretary Pastor Johnson Kwame Ade and names of Mammy Coco. So of Mammy Coco lady Mapumudin Timno, Mama Coco, Radin Shaw Anafi Mofranina Tony Bekine Esther Radin Sham Naishra a evangelist, international evangelist for missions, a evangelist Frank can do on this of Mame Doris and Yabusian Funina, Cradle Street Funina, Casera Din Shamo, no Yamokesia Pan, Yishra, a sofonina, no Yerenom, as a Mpanium Funina, Nafi, Deacon, elders, and nay, Deaconesses, Yacasera Din Sham, Mishra, a Juma 4, THM TV, a Juma Funina, Yacasera Din Shra, Bibia. No nyo bibia kese na ye kai ho se Nyankopon ya adoma echina na ya afore bokese no ofinshi afore no echina Nyankopon ya adoma ana ye bo ntie nyina ye fa ye ho nhyem na ebeye nhira de amaye we friend of THM TV wo hwe ye dwumade ya ye shro betimi afolo ye live na onso de afi mu de rade aya ama ono onso watua waboade de ama erade na ye gidi se Nyankopon ebeye okese pa na ye hira asafum manyina na ye hira wonso awgi adwa ehwe THM TV na me fasa akonya so ehira me maame sof maame Adomako one me nwanum ne nyina solo erade hira Grace ane Agatha na Ray erade hira mo na onya mo kese pa na me hira adwuma ye fo nyina Elder Ima ana ene odi rem Elder Ima osafo boache one oyere Grace Sister Grace Radin Sham na onya mo kese pa na ye new girl na Radin Shaw ene Master Adam Patrick Junior and the chinchim yen cameras na edema Master Patrick Radin Shaw pa ne Mr. Emmanuel Aye ne omo makanyina Mr. Osei ene ebusuafo nyina ya ka se Radin Sham Auntie Benes akosombo ene menwanom no ya ka se Radin Sham na onya mo kese pa ma mencha Doki Joy ai minya ketua we de manage ne ho ye pa ohu uncle Billy anana ni age ene Mr. Usuma ni nyina Victoria ai Samuel ne nana ama ne aseda Radin Sham ne abusuafo nyina Radin Shro bibia ye Shro bia se moje agya na mohwe Radin Sham no onye okese da se ne nyame adoma e besen hia yakra bye bye